Are you also guilty of assuming BMI as the gold standard for measuring body weight? But what if I told you that this seemingly simple number might be misleading you? Stick around because we are about to uncover why BMI might not be the health indicator you think it is. First thing first, let us start with understanding what is BMI. So, the full form of BMI is Body Mass Index. It is a widely used metric for classifying individuals based on their weight relative to their heights. It is calculated by dividing a person's weight in kilograms by the square of the height in meters. So its unit goes like kg per meter square. Despite its widespread use, there are several issues and limitations associated with BMI. Limitation number 1: lack of differentiation between muscle and fat. BMI does not distinguish between muscle mass and fat mass. This means that a muscular person may be classified as overweight or obese even if they have low body fat percentage. Conversely, a person with a high body fat percentage but low muscle mass might be classified as normal weight. Limitation number 2: BMI does not account for fat distribution. BMI does not consider where fat is distributed in the body, central or abdominal fat. Abdominal fat is also known as visceral fat. So, this fat is more strongly associated with health risks than fat distributed in other areas such as subcutaneous fat. Thus, BMI may not accurately reflect the health risks associated with fat distribution. Limitation number 3: variability among populations. BMI does not account for differences in body composition across different populations. Factors such as ethnicity, gender, age can influence body composition, making BMI a less reliable measure for certain groups. For example, some ethnic groups may have higher body fat percentages at the same BMI compared to others. Limitation number 4: BMI does not reflect health or fitness. BMI does not consider factors such as physical fitness, diet, and lifestyle. An individual with a healthy lifestyle but a high BMI may be at lower risk than someone with a lower BMI but poor diet and sedentary habits. Limitation number 5: age related changes. As people age, their body composition changes. Older adults may lose muscle mass and gain fat without a significant change in BMI. Therefore, BMI may not accurately reflect the health status of older adults. Limitation number 6: fixed cutoff points. The BMI classification system uses fixed cutoff points to categorize individuals as underweight, normal weight, overweight, or obese. These cutoff points do not account for individual variability and can lead to misclassification. Limitation number 7: limited usefulness for children. For children and adolescents, BMI must be interpreted relative to age and sex percentiles, which can complicate its use. Standard BMI cutoffs for adults do not apply to growing children. Limitation number 8: psychological impact. The use of BMI as a sole indicator of health can lead to stigmatization and negative psychological effects, especially in individuals classified as overweight or obese, regardless of their actual health status. Overall, while BMI can be a useful screening tool for identifying potential weight related health issues at a population level, it has significant limitations when used to assess individual health. More comprehensive measures such as body fat percentage, waist to hip ratio, and overall fitness assessments provide a more accurate picture of an individual's health. So, the most reliable alternatives to BMI are waist to hip ratio, abbreviated as WHR, body fat percentage, and other fitness assessment tests. Let us start with waist to hip ratio. So this ratio is calculated by dividing the circumference of your waist by the circumference of your hips. So in men, value above 1 represents high risk, whereas in women, value above 0.86 represents high risk. WHR or waist to hip ratio can indicate the distribution of body fat, particularly visceral fat around the abdomen, which is linked to an increased risk of cardiovascular diseases. Body fat percentage. So, body fat percentage is the proportion of fat mass relative to the total body mass. So, there are various ways by which we can estimate this value, which include skin fold measurements, bioelectrical impedance analysis, and more advanced techniques like DEXA scans. In men, the body fat percentage more than 25% represents obesity, whereas in women, if the value is above 32%, then it represents obesity. So, body fat percentage provides a better understanding of body composition than BMI alone, as it reflects the amount of fat compared to lean tissue. So, I hope you now know why BMI cannot be relied upon and why a higher BMI might not always represent a state of bad health. Thank you.